The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, everybody. Welcome to the next episode of TMD Demystified. I'm Tony Urbanek. Today, we are going to talk on the topic and title, Why Treat Symptoms Instead of the Cause? Why treat symptoms instead of the cause, specifically for TMD? That's the title. Now, as some of you may know, whether you be a current patient with the problem, a potential patient with the problem, a doctor who sees these patients and doesn't know what to do, or even a doctor who tries to treat these symptoms, I think this title and topic is for you. For those of you who follow me along, you may also know that I write a parallel blog every week, which is produced and sent to various places, distributed, including our website, which is www.urbanektmj.com. So the articles in the blog can be seen, all of them, 100 at this time, 176 of them, various titles on TMD Demystified within our website, www.urbanektmj.com. And I write the articles for the blog on Sunday night, and I produce and record the podcast on Tuesday morning, following Tuesday morning. I'm going to take a little deviation of what I usually do because the titles are usually similar or the same between the blog article and the podcast title. But the blog that I wrote last Sunday was relatively short, but extremely direct and meaningful. And I don't think that I can actually do justice to verbally go through my written article without just reading it directly. And I hate to do that. I may make comments as we go along. But as I sit down for an hour or two to write 2 pages, it usually takes me about an hour and 15 minutes, an hour and 30 minutes to write 2 typewritten pages on the blog. And this Sunday night, it went very smoothly and relatively fast, but the content, I think, will make a very, very strong point on those, whether you be patient or dentist, a patient who has this problem and doesn't know what to do, and dentists who see these patients and don't know what to do. I think it'll make a very strong point across, which is trying to answer the question, why treat symptoms instead of the cause? So if you'll excuse me, I'm going to read this article and then may make comments as I go along, but not many, because I think it's the article itself is very, very instructive as I read it. So, over the past 200 years, the healing professions have discovered the solution for a variety of diseases. Tuberculosis, which filled hospitals in the 19th century, is almost unheard of today because of the discovery of isoniazid effectively killing tuberculum bacillus bacteria. The scourge of polio, filling entire hospital wards with iron lungs, have been almost entirely eradicated worldwide because of the discovery of the Salk polio vaccine and its elimination of the polio virus. In 1890, Dr. Willoughby D. Miller, often called the first oral microbiologist, proposed the chemico-parasitic theory in his landmark work, The Microorganisms of the Human Mouth. He demonstrated that bacteria in the mouth fermented dietary carbohydrates, like sugars, into lactic acid, which then dissolved tooth enamel to create cavities. After Miller's discovery, oral hygiene evolved from a focus of pain relief, pulling teeth, to prevention, keeping them. This shift transformed dentistry into a science-based profession and introduced the daily habits we follow today. Before the 1900s, dentists only treated existing problems. In 2007, Dr. Alfred Fons realized that regular cleaning could reduce the bacteria Miller identified. Bacteria cause dental decay, and if you routinely remove bacteria and bacterial plaque by brushing the teeth, the symptoms of dental decay and dental pain would not occur. So, what do tuberculosis, polio, and dental decay have in common? What they have in common is eventually someone discovered the cause of the disease, which eliminated the need to treat the symptoms of lung consumption, lung paralysis, and dental pain. So we have three well-known, well-established diseases that until the first part of the 20th century, or the latter part of the 19th century, had no cause, but the diseases were certainly there and treated symptomatically. In the case of tuberculosis, there were literally tuberculosis hospitals that if you had tuberculosis, you were sequestered away, basically into a relatively dry environment in a facility, most commonly in the desert area if possible, to try to handle the symptoms of tuberculosis. Polio, it was just a matter of putting the person or child, because it was most children who came down with the virus, into an iron lung so that they could breathe. But it was treating the symptom of not being able to breathe and pumping air in and out of their lungs for the rest of their life in an iron lung. And I established the history of the discovery of bacteria that cause dental decay in plaque, which causes acid to form on the tooths, creating dental decay. And until then, the only solution was to handle the symptom of pain by taking out the teeth, or later on, taking out the decay itself and filling it with the filling material. But you're only treating these symptoms. But once the cause was determined, the game changed. So that's what tuberculosis, polio, and dental decay have in common. So why in the 21st century we're now into, do dentists insist on continuing to treat the symptoms of temporomandibular joint disorder instead of the cause? It has been conclusively demonstrated that chronic inflammation within the temporomandibular joint creates all of the disparate symptoms of TMD. And again, the disparate symptoms, these are just the well-accepted, well-established symptoms of TMD, chronic, and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, feeling of fullness in the ears, dizziness, vertigo, which are different but similar, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. There are several other symptoms that are coming down the line that I am finding are related to TMD, but we'll save that for a different time. So for emphasis, the question is, so why do 21st dentists insist on continuing to treat symptoms of the temporomandibular joint instead of the cause? The answer may surprise the reader or listener. The short answer is the lack of application of science and critical thinking on the part of dental educators and practicing dentists. It has been scientifically and statistically proven that decreasing chronic inflammation within the temporomandibular joint will decrease the symptoms. Chronic inflammation causes the symptoms. Make the chronic inflammation go away and the symptoms go away. This information has been in the scientific orthopedic literature for over 50 years, but dentists continue to treat the symptoms of TMD with drugs to decrease the pain and suppress the nervous system. Botulinum toxin A, which is Botox, is the most obvious and well-known trade name, to paralyze muscles that are painful. If you have a muscle that's painful, you can paralyze it and that muscle won't cause pain anymore because it won't work. And you can paralyze all the muscles of the face that you want, but 3 months later, you'll be doing it again. Night guards that protect the teeth from fracturing due to clenching and grinding, which is called bruxism, and dry needling to relax painful muscles. These are just four of the most prominent examples of treating symptoms instead of eliminating the cause, which is chronic inflammation. 15 years ago, I discovered that removing the functional loads on the temporomandibular joint using a simple oral device and protocol decreases the chronic inflammation within the temporomandibular joint, thus decreasing the symptoms. Unfortunately, or fortunately, we had to call it the urbanic device because my patients on survey wanted to call it the miracle device or save my life device, and I couldn't do that. So we just had to double back, had to call it something, had to brand it something. The urbanic device and protocol eliminates the cause of TMD, like eliminating the cause of tuberculosis, polio, and dental decay eliminates their symptoms. Dentists have been limited to treating symptoms for decades, and it's hard to get doctors to change their professional biases and habits. Oral surgeons want to do surgery, and dentists want to do what they were taught in dental school, even though it is not scientifically defensible. Then there is the influence of the pharmaceutical companies with their unlimited marketing dollars, convincing doctors that drugs are the answer. I'm sure you know of several examples of that recently, which have turned out badly. There's multiple examples of that. It is an enigma why most dentists prefer to treat symptoms of TMD rather than the cause. If you know of a dentist or are a dentist who treats TMD symptoms rather than the cause, you might consider asking why. It's that simple. This is not rocket science. This never was rocket science once it was determined that chronic inflammation creates the symptoms. That was the missing data. That was the missing series of data, which is physiologically, which I've explained so many times on prior episodes, physiologically, anatomically, neurologically, how chronic inflammation in the temporomandibular joint itself creates headaches, bad headaches, confused with migraines all the time. Earaches, bad earaches, confused with ear infections all the time. Neck pain, jaw pain, ringing in the ears, fullness in the ears, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, ringing, fullness, dizziness, defined as Meniere's disease, called Meniere's disease by the ENT doctors without any possible treatment. They admit they don't know what to do about Meniere's disease, but those three symptoms go away with decreasing the inflammation within the temporomandibular joint. So why wouldn't a doctor, or why wouldn't a patient prefer to use a treatment modality that treats the cause rather than the symptoms? And for the patients who have the problem, and for the doctors who treat the problem, I think you need to ask yourself, why? Why? It's that simple. So if you are a patient who has the problem, we have a increasing number of doctors throughout the United States who use this very simple device and protocol. It is a patented device, and protocol is not patent, but the device is patented. And we teach you how to use it. And there's a growing number of doctors throughout the United States, not anywhere near enough. We have doctors in 18 states now and growing, almost on a monthly basis. We add new doctors. And for patients throughout the country, and frankly, throughout the world, who are run around in circles on trying to find a real solution for this problem. And I mean run around in circles for not days, not weeks, for months, decades. And I've talked before about it is the norm for patients to come in to see us here in our practice in Middle Tennessee that have 5, 10, 20, 30 years of these symptoms going on, and they've seen multiple doctors, misdiagnosed as migraine headaches, ear infections, Meniere's disease, and all other kind of orthopedic problems, when all of these symptoms are coming from chronic inflammation within the temporomandibular joint. If you'd like a list of doctors who can do this in your vicinity, I encourage you to do that, and that is available on our website, www.urbanictmj.com. If you are a dentist, because you have to have some dental training, I'd love to teach this to medical doctors, but they have no dental training, so they cannot provide the service. I'd love to teach them, but actually, when I attended medical school at Vanderbilt, I was given 1 hour by the dean of the medical school to teach my classmates in medical school everything that they needed to know about dentistry. I had an hour to do that. Obviously, that was not enough. It was kind of a joke at the time, but I was given an hour and asked to teach my colleagues, my dental student colleagues, as much as I could, as much as I should about dentistry. And that's about how much medical doctors know about dentistry. So you have to be a dentist to provide this service. And I encourage dentists who want to do this, you have to get enlightened, you have to take a short course, and then we basically teach you how to do it, make sure you do it correctly. That's the purpose. And I'm on a mission to make sure that as many of the patients, primarily women, 90% women, 10% males, who have these devastating symptoms that won't go away, that are run around in circles for decades, that they need to find proper treatment, do something that actually works, which is getting rid of the chronic inflammation within the temporal joint. With that said, I appreciate your attention. I appreciate you being here. I hope it is helpful. That is my purpose. I hope that you can use this information to help yourself or help your patients. I look forward to speaking with you and recording the next episode of TMD Demystified next Tuesday morning. And until then, I am Tony Urbanek. And again, this podcast is entitled TMD Demystified.